Hello everyone, welcome to today's CellTalk presentation. Today's CellTalk will be delivered by Jay Darji. He will be presenting the topic lung cancer prediction using robust machine learning and image enhancement methods on extracted gray level co-occurrence matrix features. Let me introduce Jay. Jay is an engineer with well-developed skills in data analytics, research, and software development. He is also a good communicator with good interpersonal skills and is used to working in a team. He is always enthusiastic to learn and undertake new challenges. At Renix Life Sciences, he works as a junior engineer, working in a technical research department for digital medicine. He is also responsible for developing various statistical methods for anomaly detection with human heart rate data captured with the help of wearable devices. He is an electrical engineer. He did his bachelor's degree in electrical engineering from the Institute of Infrastructure Technology Research and Management, along with voluntary work at Blind People's Association. Moreover, he has done research in biomedical signal processing and machine learning as well. Since the completion of his studies, he has wanted to become a data scientist. Thus, he began learning new data analytics and machine learning through a summer internship. At Renix, he hopes to increase his technical knowledge while providing solutions and improvements to common industry problems. In the long run, he aspires to contribute significantly to industry development and optimization to create something that would genuinely improve the lives of thousands. I move ahead to Jay for his presentation.
Thank you, Vijay sir, for this great introduction. Hello everyone, I'm Jay Darji, and today I'll be presenting about the lung cancer prediction using robust machine learning and image enhancement methods on extracted gray level co-occurrence matrix features. So the original authors for the paper are Lal Hussain et al. And the topic selected is new technologies related to lung cancer. The paper was published in Applied Sciences. It is a journal by MDPI, which has an impact factor of 2.7, and the paper published in year 2022. This research has an impact on lung cancer, grade classification, and the correlation between AI and lung cancer. Yeah, so the introduction. We all know that what cancer disease is. It is basically the cells in our body grows out of control, and when it happens in the lungs, it is called lung cancer. So the lung cancer typically does not show or cause signs and symptoms in earlier stages. It is only visible after the disease has progressed significantly. So basically, there are two main types of lung cancers. One is small cell, and the other is non-small cell. Both are different, and it basically grows differently, then spreads differently, and also the treatment for both of these are different. The non-small cell spreads very slowly, and the small cell cancer spreads very rapidly in our body. Small cell is related to smoking and forms tumor and spreads in our entire body. In the present era, cancer is the leading cause of demise in both men and women worldwide, with low survival rate due to inefficient diagnostic techniques. In 2021, about 19 lakhs new cancer cases were encountered and around 6 lakhs deaths were projected in only United States. Usually due to late detection of cancer cases, there is 16% survival rate in non-small cell lung cancer, and also for small cell, the chemotherapy is a standard therapy for treatment, and for that also the response rate in patient is 60%. So the survival rate is thereby very less. Present challenges are like the diagnosis of lung cancer is mainly based on the findings of traditional methods like chest radiography, computed tomography, then MRI, and then positron emission tomography and biopsy. So because of the late diagnosis, lung cancer prognosis remains poor, and advanced metastasis is usually present during the diagnosis. So treatment modalities depends on the extent and the type of cancer, include surgery, radiotherapy, and chemotherapy. CT is a very sensitive tool for diagnosis and assessing the extent of tumor growth and monitoring disease progression. Objective of this research is to study the different image and enhancement methods to improve lung cancer prediction by improving the image quality and to further investigate which enhancement method is more robust in identifying the uh, category of cancer. So this is the flow diagram for the methodology of this study. There are two parts. In first, authors are putting original image for the classification, where they are calculating GLCM features, texture-based features on original image. Then they are feeding it to the 5 different algorithms to classify whether the image is having non-small cell lung cancer or the small cell lung cancer. In the different path, they are taking original image, then they are augmenting the image, which basically incorporates methods like rotating the image or flipping the image and like that. After that, they are using image enhancement techniques. In total, they are using 5 techniques. One is gamma correction, then image adjustment, then thresholding. After that, there is a contrast and stretching, and the last is histogram equalization. After that, they are calculating the GLCM-based texture feature. After calculating this image and after performing this image enhancement, and then they are feeding that GLCM features to the classifier and classifying the binary outputs. They are also using tenfold cross-validation to avoid the overfitting in the model. Yeah, so they are using Lung Cancer Alliance publicly available dataset, which is having 76 patients, and with a total of 945 images, including 377 from an NSCLC and 568 from a small cell cancer. So the first step in data pre-processing is data augmentation. So why data augmentation is done is to avoid the overfitting. Like the data set we see here is very small, like 76 patients is only there. So they are increasing the size of data set by augmenting the data set, which includes the rotation, flipping, cropping, shearing, and translation geometric transformation of the image. After that, there is a image enhancement method. So before computing the features, image enhancement improves the prediction performance. So good quality images and the improved visual effects of the images can further helpful for diagnostic system. These are the various image enhancement techniques used in this study. First is image adjustment. So basically, for better and enhanced visual quality, we are utilizing image adjustments, which can be of color balancing or contrast adjusting or basically anything related to brightness. Then there is a gamma correction method. Uh, this is to correct the contrast and brightness. It it is basically the relation between the image image input pixel intensity and the displayed pixel intensity. So gamma value of one, which is basically uh, whatever the input pixel was, will be the output pixel. When the gamma value will be greater than 1, the image will be on darker side, and gamma value less than 1 will be on a brighter side. Then there is a thresholding technique. This technique is used to segment the object from the background. We are basically introduce a threshold to tell our system that if pixel intensity goes beyond this threshold, we'll consider as a one class, and falls below this threshold, then we'll consider as another class. So basically, we are assigning a different class to an object, and that's how we are differentiating from the background. So this is what the thresholding technique is. After that, we have contrast stretching. So it is to improve the visibility and better distinguish between the background and the object. So this is used when we have a limited dynamic range. So to improve the dynamic range, we are doing contrast stretching. And there is a histogram equalization. When we want to redistribute the pixel intensities in our image, we use histogram equalization. Sometimes when we have more noise in the image, we just use this technique to reduce the noise in image. After that, moving on to feature extraction. To capture relevant properties from the image, we calculate the GLCM, which stands for gray level co-occurrence matrix. So GLCM is a statistical feature to analyze the image, and in this we are calculating the frequency of neighboring pixels, like how many times the same pixel has occurred in the image, and it helps us to detect the texture based features more correctly, and also it helps us to identify the patterns in image. Patterns are related to brightness or coarseness or anything like that. After that, there is a classification step. So authors have used SVM with polynomial, radial based function, and Gaussian kernels. Also, they have used naive Bayes and decision tree algorithm to classify the binary outputs. They have also used tenfold cross-validation method in training and testing data for validation. And this is done because they were to avoid the overfitting of models. They computed the machine learning algorithms performance based on specificity, sensitivity, then negative predictive value, positive predictive value, and AUC and accuracy. These are the performance metrics for the machine learning model. Yeah, so these are the results with they have obtained using histogram equalization method. So they have found that SVM with polynomial kernel has received best accuracy among all the 5 algorithms, which has happened to be 97.82%, and the AUC is 0.99. After that, they have received the results with gray level thresholding. They have again received better result with SVM and polynomial kernel, which is 99.46, and AUC is 0.99. They have also calculated the results without image enhancement, and they have received best result with SVM and RBF kernel and the Gaussian kernel, which is same at 99.89% accuracy. They have extracted the result with gamma correction, and they have received result with SVM and RBF kernel, and the accuracy is 100%. Here they have kept the gamma value of 0.5. With image adjustment, they have received 100% accuracy with SVM Gaussian kernel and the RBF kernel. At the end, they have received the results with contrast stretching. They have kept the threshold value at 0.02 and 0.98, and they have received 100% accuracy again with SVM Gaussian kernel and RBF kernel. Here, 0.02 and 0.98 means that second percentile is mapped to the The second percentile is mapped to the lowest pixel intensity value, and 98th percentile is mapped to the highest intensity value, and that's how they have increased the dynamic range of the images. So this table shows the comparison between the study and the studies in the literature. Here, the first column is for the author. Second is the features used in the study, and the last column is the percentage. People have used different methods like histogram, spatial, GLCM, statistical methods, and also different machine learning methods to classify these two different categories of lung cancer. So this study has received almost 100% accuracy with different image enhancement methods like image adjustment, contrast stretching, and gamma correction values. So in the conclusion, this study's findings emphasizes the significance of addressing lung cancer due to its immense threat and high mortality rate. The combination of handcrafted texture features, machine learning algorithms, image enhancement methods, and data augmentation proves to be a promising approach in further improving the diagnosis and prognosis of lung cancer. So finally, what is the impact of this research? The impact of this research lies in its potential to advance lung cancer detection and diagnosis, improve treatment outcomes, and provide a framework for further research and application in the field of medical imaging and cancer diagnosis. Yeah. So this brings to an end of this presentation, and thank you for listening me patiently. If you have any question, you can reach me out at joy@renix.org.
Thank you, Jay, for that informative talk. Now, coming to the questions. If any of the audience have any questions, they can type in the message box. So I have one question. Can all these algorithms together give improved accuracy?
Like you are talking about ensemble method?
Yes, ensemble of all these algorithms.
They haven't provided any evidence for that, but
Okay.
if we ensemble methods generally do provide better accuracy. If we classify and not getting better accuracy with
So
single
if
classifier.
particular sample is getting consistently classified in accurate category by multiple softwares, that will increase the further accuracy or confidence in that particular classification. So next question that I have is, have they described any minimum tumor size that is possible to detect by this method?
No, they haven't mentioned anything like size of the tumor.
Okay. Nupur has a question. Why SVM is outperforming here?
Yeah, so they haven't mentioned, but what basic sense of mine is telling that the data set is small. Like we saw, there are only 76 patients, and we know that for smaller data set, we need a highly biased model so that it can predict the data set correctly. So the SVM is happen to be one of them, and that's how maybe it has outperformed all the other algorithms.
I hope that answers the question. I don't see any other questions. Thank you, Jay, for this informative talk. Can you move on to the next slide?
Yeah, sure.
So our next presenter is Dr. Devki, and she will be presenting on 19th July 2023. Her topic of presentation will be glycemic index and glycemic load with an overview on fermented foods. With this, we conclude our today's CellTalk. Thank you everyone for attending.